Namaste, my dear friends. I hope you all are doing well. So, the topic for today, which we are going to discuss, most of the time we have this curiosity how to safely practice the asanas and how to prevent the injuries. How to practice safely, how to prevent injuries. Asana safety and prevention of injuries. We have so many thoughts, misconceptions that comes when we are teaching or when we are learning about the yoga, specifically in relation to the asanas. That asana is designed or meant to be for the injuries, or how when the person comes to us with problems, with imbalances, how to prevent or how to cure those injuries. So this is the one more thing, that asana is not meant to design to get the injuries. Asana we have to use in this way that particular asana, when I'm teaching to my student, that particular pose, when I'm teaching to my student, it becomes the remedy for the problem. This is the goal for a good teacher, for a good student. When the person comes to you with the back pain, after your practice, when it is going back and saying my pain is reduced 1%, this is what we need to hear. It's not if the pain is increasing. The person is going back to the home. After that, when he came to the next day, pain increased. Then our confidence level, right? Then our curiosity gets more higher. So confidence gets low, curiosity becomes more. What's next now? So asana is that state of movement that we are not going to focus into the universal alignment. A good teacher is that who knows how to make your client flexible, or how to get your client out of the pain, out of the problems. So you know how to make your client flexible. You know how to get out of the problems. But what we need, just a little bit awareness or about teachings. We need just awareness about the teachings, what I am teaching, how I am teaching. So remember the 4 things always. How to come into the pose. It's different for the different level of practitioners. How to stay into the pose. Like, it's not when your breath is disturbing, your balance is disturbing, and you are trying to saying your student, hold. No. Stay comfortably. Enjoy the pose. Stay comfortably. Enjoy the pose. Enjoy the breath. Is your breath is flowing properly or not? Or are you feeling any compression? Are you feeling any disturbance on your breathing pattern? So how to come into the pose? How to stay into the pose? Right? Third thing, how to enjoy the pose. You have to enjoy the pose also. If you mentally you are stressed, physical body is stressed, you are not enjoying. So how much repetition you practice, the pose will not give you any benefits then. It will give you more imbalances. So how to come into the pose, how to stay into the pose, how to enjoy the pose, and the 4th thing is how to come out of the pose. These are the 4 important things which we have to remember during our teaching or during our practice. So if we go to the next slide now, after the asana safety and prevention of injuries, so the purpose, when we talk about the purpose of joining yoga classes, people have different purposes. Some people have a fitness goal to make ourselves fit, balanced, and for the general positive health. right? People have their own choices which type of practice they choose. Some people are usually loves to practice hatha yoga. Some people are for Ashtanga. Some people are for Iyengar. Some people are for restorative. So there are the own different goals according to their level of interest and their level of practice. So this is the one is the fitness and general positive health. Some people for the peacefulness or a more enlightened life because of the busy life, hectic schedule, depression comes, anxiety comes, stress comes. So just bring yourself back because in the yoga there is not only the asanas, there are combination of practices are there. So for the peacefulness or a more enlightened life. Some people come for remedy also, as we have discussed earlier now. Remedy for specific medical or health problems. So sometimes they come for the remedy, for the solution, for the prevention, for any specific medical or health problems. Some come for remedy for emotional problems when there is you cannot release, only holding that unwanted emotions, unwanted thoughts. So some practices in the asanas, some pranayama practices, meditations are there that awaken yourself. And some people have other reasons too, the different reasons. So these are some purpose of joining yoga classes. This you have to ask the student before to start the class. What is the purpose to join a yoga class? What is the purpose to join yoga practice? So then you can target easily with individual to individual. So if you go to the next slide now, what are the causes of injuries? There are so many causes of injuries. Sometimes the excessive student effort. The excessive student effort, we can say, sometimes there is a competition. It feels we all are humans, right? We all are humans. Like sometimes people are trying to, I have to touch my neighbor who is practicing. He or she is able to touch. So you don't have to force. Go with your own body. Listen to your body always. Where I am feeling comfortable, I am enjoying the pose up to here, stay, no problem. Not today, tomorrow I will come here. So sometimes student is putting excessive efforts. So if you can see, if you have a good eyes, you can see easily, he or she is not moving with the alignment, he is moving out of the alignment and trying to force herself or himself. Inadequate teacher training sometime, which is not designed properly, right? The inadequate teacher training, like if you're practicing only forward bending, not going with some preparations, no warm-ups are there, no meditation, no pranayama, no breath work, so then also injury will happen. More people doing yoga overall. Some people ask that question to me that, what is the average to teach? What is the average student to teach? Then I ask the question, you are asking for how many students? You don't have to ask what is the average to teach. I have to ask how many teachers are there in the class which is going to teach. Then we can say how many students are there. For one teacher, 10 to 12, maximum 15 students. If you have more students, you need assistant teachers too, who can watch them, who can correct them properly. So more people also can do yoga overall, but we need some assistant teachers who can watch their imbalances, who can watch their misalignments. The next we come unknown. Go backwards a little bit on the back slide. Unknown pre-existing condition. Sometimes student doesn't tell you about any pre-medical condition or pre-existing injuries. So that's why when you are trying or plan to teach a class, first a little bit consultation over there. Generally you can ask to the student that anybody in the class who has any open spinal surgery, any open cardiac surgery, any back pain, right? Any knee pain, ankle pain, any kind of imbalances with the hormones during, or sometime we are talking about mostly with the females menstruation cycle, or anyone who is pregnant in the class. So these are some pre-existing medical conditions, some common conditions that we have to ask the student first before to start a class. Then lack of discipline in food and lifestyle. Sedentary lifestyle and not a proper nutrition of the food. That also imbalances your muscle growth, your structural growth, your digestive functions, your mental functions and the nervous functions. So these are the causes of injuries. So if we go to the next one now, the next slide. So top causes of injuries is poor technique or alignment, right? Poor technique or alignment. The techniques, different teachers have different techniques, how they are teaching. When I'm working with for some problems, the command has to be simple and clear. The command has to be simple and clear so that easily the student can catch the command and adjust. You don't have to get or use more complicated words or more complicated sentence with the beginners mostly, who is new to the yoga. Previous injury or condition, any previous injury and you are forcing too much to a student. Excess effort of student, inadequate, improper instruction from the teachers. So these four causes are of course interrelated, and addressing any one will often be a gateway to addressing the others. So these are the four causes, right? The poor technique or alignment, previous injury or condition, excess effort of your student, and inadequate or improper instruction from the teachers. So if we go to the next slide now, so they are the factors, some important factors that likely to cause injury, right? Some important factors that likely to cause injury. That is your excess effort, as we have discussed, too much or too less. Poor technique or alignment, right? Which technique you are using. Sometimes people ask to push your kneecap up, to push your kneecap up, push your kneecap up, push your kneecap up. The beginners, what do? They're trying to hyperextend their knees. What they try? They try to hyperextend the knees. We don't have to overload the joint. You have to ask the client, generally with the beginners, engage your thigh muscles. As he or she try to engage the thigh muscles, knee is neutral. You are not getting any overload to the joint. You are using a correct muscle, right? And use simple alignments. Use of the props properly with the beginners, right? Use of the wall, use of the chair, use of the blocks. So that way we have to go through. Inadequate instructions, the instruction has to be adequate in a way. Sometimes improper instructions are there, that we are talking about the back and the pelvis is also getting misconfused there. So whatever the structure of the body, you have to move, isolate that structure and bring to create a focus of the student on that particular structure of your body. Poses done too fast. Sometimes they are in a hurry. It's not, sometimes people say, come to the warrior two, people are jumping like this and do this and do this. We have to break the pose into the intervals, right? What we have to do, we have to break the pose into the intervals. So command has to be little bit into the intervals. So you have to break the pose, like take 3.5 to 4 inches according to the beginner, intermediate, advanced level. Then rotate your right ankle out, then try to sit on the front knee and then bring your hands up. So you have to break down the components of your commands, break down the components of the pose. Then the pose becomes more easy for your students. Pressure from teacher or a group sometime, right? The pressure from teacher or group, it happens mostly in the teacher trainings. Like, oh, this category of pose I have to finish today. Yes, this happens because there is a days. Right? There are days, in that much days we have to finish the training. So you can ask the client, like, you don't have to force too much. If you are able to repeat 2 times, 3 times, with your ease, your breath is normal. So after that you can just watch. You can just watch, absorb. Right? Absorb or observe. Absorb the knowledge or observe the pose. You can write it down if you want to write something, but don't force. So don't create any pressure from the teacher and whatever the group is there, your colleagues. So that's why I always say, listen to your body. If you feel like that, come out of the pose, just watch and enjoy the pose. Sometimes overly loose muscles and ligaments. Right? Overly loose muscle and the ligaments. Like in the beginners mostly, or if there is any pre-existing injury, like in the knees, muscles get loose, ligament get loose, and you are trying to ask the client to sit like in this way and trying to get into the backwards. So it creates extra stress on your knees. So just change the alignment. Rather to do this, ask the student, we have to take the benefit of the pose. We have to use the pose as a remedy for your student, not the injury. Right? Don't create excessive injuries. Rather to sit like this and doing backward bending, you just hold it here. I know there is extra pressure on the knee, and ask the client to bend the knees like, or bend your back like this way, and not creating any extra stress on the knees. So this is how we can change the command. If there is over loosely muscles and ligaments, don't ask the client to hold the posture for the long duration of time. Strengthen the ligaments, strengthening exercises first. Strengthening exercise to your muscles, and then ask the client to get into the final pose. So that's why I always say universal alignment according to the student. We don't have to force to your student to get the universal alignment. We have to work with the individual alignment according to the student. We have to teach with the quality, not for the quantity. Sometimes undisclosed prior conditions. Some people, sometimes they don't want to disclose their condition. So you have to be very careful and be very free, and you have to ask the client, I am not able to start the class until, if you have any kind of condition which you don't want to discuss, you can write and just give it to me. After that only we have to go for the poses. Otherwise we will be in the trouble. So if there is any undisclosed prior condition and you are forcing too much to the student, maybe the reversing of the injuries. Maybe the injury will come back again. Poor warm-up. If the body is not properly warm up, right? If the body is not properly warm up, that's why we say before to get into the sun salutation, directly jump to the sun salutation, you have to release the joint first, right? You have to release the joint. That's why we say joint movement we have to use. What we have to use? Joint movement. So when the joint is free, you can easily stretch the muscles. But if your joint is stiff, you're trying to stretch your muscles properly, stressing too much, stretching too much, what will happen? Muscle will tear. It will get overstressed sometime. So proper warm-up we needed before to start the class. Right? Proper joint release from the major joints of the body, guys. Then sometimes over tight muscles and ligaments. Sometimes tight muscles and ligament, it basically happens on your lower back or with your hamstrings, with your shoulder muscles. So do some stretches, do some warm-up, do some rotations to loosen up your joints, to loosen up your muscles and ligaments. So some static stretching you can practice to hold the stretch, not only using a strap, going and coming back, going and coming back. You have to use the strap, hold it, so you can feel the stretch reflex. So increase the stretch time by the static way. Class size, that's what we have discussed, class size, right? If So many people doing yoga overall. One teacher is there. You cannot focus to each and every one. And basically when they are beginners. So class size also matters. If the one teacher, 10 to 12, maximum 15. If more than that, you need assistant teacher to watch their imbalances. Teaching sequence. Teaching sequence is a main role also. In which sequence you are teaching? Are you using the poses which is difficult in the beginning, or are you preparing your student for that particular pose? Like from the grounding pose, you are going to the standing. Then the standing, when the person able to stand, bring some strength to the muscles against the gravity. Then forward bending we can do easily. Or in one day you are teaching forward bending, and same day you are teaching inversions. That doesn't make sense. If you are teaching the forward bending, and after that you are teaching gentle backward bending, so there is a balance. So posture followed by counter postures. So you can use the agonist and antagonistic muscles. So then there will be the balance. So teaching sequence has main role also. Fatigue, right? Muscle fatigue, this is the most common reason. Doing poses too much quickly, holding the poses for the longer duration of time, holding the poses in your discomfort range, not in the comfort range, muscle will get fatigued easily. So nutrition also needed here, and the pose duration of holding also matters here. Sometimes the poor overall conditioning of the body, right? The poor overall conditioning of the body, that you're doing yoga for 2 days, after that 6 days break, then you're coming again back. And mostly with the beginners, the history of job, the nature of job, how much movement is there, no exercise in the past 6 years, eating more junk food. So poor overall conditioning of the body has a main impact on the injuries also. And sometimes poses held too long, right? In the competition, sometimes happens. Sometimes you bring awareness somewhere away from your body, and you're trying to hold the pose for the longer duration of time. So there is no competition with others. We have a competition with ourselves. We have to hold the pose for 2 minutes, okay. I'm holding for 15 seconds, okay. Next day if I'm holding for 18, this is your progress. This is your change. One day you hold 15, next day you're holding 12, then also it's in the decreasing mode. So don't force, listen to your body, enjoy the breath. This is the pose for you. Overweight persons, right? Overweight, which we call the obesity, right? The overweight, obesity. So that's why we say with the overweight persons, we have to be easily go, because the bone density is different, fat is different, body weight is different according to the height. So we don't have to push them more into the dynamic practices. Gentle, restorative, releases the pressure first. Then if you want, take into the static postures and then to the dynamic poses. So there is a way to go with the sequence. Falls, some people have no balances. Repetitively they fall into the classes. Overly loose muscles, ligaments, no strength. Mostly happens in the osteoporosis, the thinning of the bones. So there is a regular falls. So work them first with the strength, not with the mobility. Gentle, strengthening, conditioning, and then get into the poses. Advanced age. So people has with the advanced age, with the more problems that can cause the injuries, because the body is now into the degenerative states. Right? The body is into the degenerative stage, so you cannot push or pull the students in the advanced age too much. So more restorative focus, just to bring the awareness and maintain the normal healthy state of body. Sometimes the prop defect, right? When you don't use the prop properly, where we have to use it, or sometimes the positioning of the prop, sometimes the type of prop which we have to use. So that can cause injuries also. So use of the prop is more important. How to use it, which type and which place. So these are the factors that likely to cause injury during yoga practices. So be careful about all these factors. So if we come to the next slide now, asana associated with injury now. We are going to talk about the site, the place in the body, and frequently associated asanas. Right? The frequently associated postures. If I'm going to talk about the neck, my dear friends, right? So headstand, as we all know, if the muscles are not balanced, the headstands, shoulder stand and pluff pose, the halasana, that are morely likely to cause injuries in this area of the neck. If the muscles are not prepared well and you're using the muscle too much and going directly to the headstand, it can cause injuries to your neck. Shoulder and the rotator cuff muscles. Shoulder and the rotator cuff muscles, that is your chaturanga dandasana. So that's why with the beginners, we have to be very careful. Don't take them directly into the floor. Ask them to start with the wall first, just to feel the muscles. Then you can use the chair. So chaturanga dandasana, downward facing dog, right? In the downward facing dog, urdhva dhanurasana, upward facing bow, and all binds, right? All binds that can cause the injuries to your shoulder and to the rotator cuff muscles. So that's why a proper stretch needed first and some strength on your shoulder muscles. And it can also, if your shoulders are strong, it can save your neck too. Because the neck, the cervical spine has maximum mobility and less stability. If we talk about the low back, so mostly in the low back, seated and standing forward bends, twist and back bends, right? Seated and standing forward bends, twist and back bends. Mostly with the beginners, tight hamstring, tight back muscles. Throwing the pelvis away, that can cause more injuries on your low back, sacroiliac and sacrum area. If we talk about the knee joint, mostly with the warrior pose 1 and 2, right? The warrior pose 1 and 2, the knee goes sometime here, knee goes here, sometimes we are crossing the knee over the ankle. So that we have to take care. Triangle asana, trikon pose, trikon asana, triangle pose, sometimes the knee also rotating in, out, sometimes it is going hyperextending. So we must have to be careful that it has to be neutral, the kneecap, and slightly micro bend your knees. The wrist and hand. Nowadays, how much pressure we are putting to our wrist? We are using too much, but the strength is less. If we check to press one finger, strength is very less. So the too much pressure on the wrist, but we never focus on the strength. It can lead to compression sometime on your arteries and the nerve. So pain radiate, numbness is there, and directly you're trying to put the pressure on the downward facing dog. Chaturanga dandasana, Adho Mukha Vriks asana, that is handstand, crane pose. So arm balancing, handstand poses, and poses which is creating the whole body weight on the wrist, that can lead more damage to your wrist joints or the hand. So these are the some site of injury, place, and frequently associated asanas. So if we come to the next slide now, hamstrings, right? The hamstrings, the Paschimottanasana, seated forward bend, Parsavottanasana, and Virabhadrasana. So warrior, seated forward bend, Parsavottanasana. If the muscle hamstrings are tight, before to get into these poses, you can practice some hamstring stretches. Or you can bend your knees. So there will be no overstretching of the hamstrings. Groin region, your Hanuman Asana, monkey pose, extended triangle pose, and wide leg standing pose. your Konasana, bound angle pose, Upavishta Konasana, that poses can create more injuries on your groin. So strengthening here needed, and basically if you feel that this much range is there, so wide leg split, if you are trying to practice it guys, so don't try to overstretch your groin area, because the nerve supplies here is too much sensitive, right? The nerves are too much sensitive, so when there is any overstretching and any herniation is there, the pain is too much, you cannot bear that, and it will take long time to heal too. Thoracic ribs, twist and back bends. In the thoracic and ribs, mostly in the twist and back bends, when there is a lack of mobility, we are trying to press too much. Sometimes intercostal muscles get over compressed and or over stressed. Into the back bends also, sometimes we are trying to push too much compression on the thoracic spine. If you're talking about the eyes, mostly the inversions. When you're trying to get into inversion and sometimes you fall down on your eyes. So maybe the high blood pressure sometimes has a more risk of injuries there. Sometimes clotting into the eyes, and sometimes you fall down, so some mechanical injury can also cause here. Cardiac inversions, mostly with the high blood pressures, any open heart surgery. Fast vinyasa practice increases the heartbeat more, so heart has to function more harder then. Excess effort or heat, during heat also, if the person has any cardiac history of disease, please try to avoid. Or when there is an improper breathing. When there is a breathlessness, must be go with the static poses. In pregnancy, intense twist, inversions, Dhanurasana, upward facing bow, Salabhasana, locust pose, boat pose, we have to avoid. If there is any trauma or people have less balancing problems, we have to avoid headstand and balancing poses here. So this is the site of an injury and frequently associated posture which you have to take care of that in these poses, if we are going to teach, maybe we'll get the injuries here if we are not teaching with the proper alignments. So that how we have to bring awareness to the asana safety and prevention of injuries. So if we are doing any kind of category of posture, you have to be careful. We have to take a good eyes on this part when I'm teaching that sequence or to that part. Or when I'm teaching these poses, I have to take care of my hamstrings here and how to prevent it and how to get more range by practicing these poses. So if we go to the next slide, my dear friends. Prevention of more injuries from a previous injury. How? Information on any pre-existing conditions. Right? Information on any pre-existing conditions. Mentioning any contraindication of a pose. If we are going backward bending, we can say if the person has tight shoulders, please be careful. If the person has any problem with the heart and the lungs, please don't overstretch. So mentioning any contraindication of the pose, so the person has to be more aware. And the general knowledge of anatomy and physiology. Sometimes people lack these two, anatomy and physiology. Until we don't know about the structures, how much flexible you are, you can work on your body, but you cannot teach properly to the students how to get benefits from that poses. Because we have to know about the structure if we know there is a problem. Where the structure is located, what kind of movement happens when I am doing this pose, and what are the physiology, what are the functioning of that particular organ or particular muscles, etc. So these three information has to be there. Any pre-existing condition, ask the client before to start the class. Mentioning the contraindication of pose when you are starting to teach a pose, tell them before. And general knowledge of anatomy and physiology. If you learn about it, you will see the teachings, you will see the benefits to your students. So if we go to the next one, how to prevent neck injuries. Before we have discussed, the poses give us injuries. How to prevent neck injuries? As we say, cervical spine, these are 7 in number, cervical spine. Most vulnerable due to high mobility and less stability. So the 2 types of poses to protect the neck are back bends in neck protection. Back bends in neck protection. So achieving the maximum possible arch in the thoracic spine, that is camel up, dog, cobra. So before to get into the person into the back bends, so you can achieve the maximum possible arch in your thoracic. So you can practice properly, like if you have to go, you don't have to pull too much. Just ask the person, first bring the awareness into the gently, first bring, not too much we have to go completely, just not to focus, just bring some thoracic extension here. So bring some thoracic extension here. That we can do the camel, cat and camel poses if we are doing this, doing this. And we can do the up dog. The lumbar has to be stable. We are doing this way. We can check the thoracic mobility with the student. So don't drop the neck too much. Bring the thoracic mobility, so there will be no extra pressure on your neck area. Inversions. Use the arms and shoulder to support the body weight. So if your arm muscles are properly strengthened, shoulders strengthened, so there will be no extra pressure on your neck. Prevent excess flexion of the neck. Sometimes people, when they are going for the inversion, they are trying to compress like this, trying to lock the chin. So if you are doing, these muscles are already passive lengthening is there. If you are trying to do the excessive flexion, it creates compression on your disc also, between the cervical spine. So prepare by strengthening and stretching the neck and shoulders. Before to going for the inversion, do some strengthening of your neck muscles by holding, pressing one side, resisting from others, pressing one, resisting from others. Do some side stretches, shoulder mobility exercises with the strap we can do it. Strengthening of the shoulders, doing some downward facing dog, dolphin pose, some chaturangas, so that you can check your shoulder strength before to get into inversions. Prepare by strengthening and stretching the neck and shoulders. Abdominal strength and vigorous stretch in the legs also needed. Abdominal strength, if the core is weak, not possible to balance. Hamstrings are tight, you cannot extend your knees properly. Right? So that's why we say, check the core strength first, do some core exercises, hamstring stretches and calf stretches. So vigorous stretch in the legs also required. So abdominal strength and vigorous stretch in the legs, my dear friends. So if we go to the next one now, preventing lower back injuries in forward bends. So consideration of the anatomy of the spine, pelvics and legs are relevant here. Considering the anatomy of the spine, pelvis and the legs are relevant here. Problem, tightness in the hamstrings. Right? People have tightness in the hamstring. They are not trying to bend from the lower back. Sometimes you're trying to force too much and doing this. Avoid. Hold the static. Move from the lower back easily. Check the pelvic tilt. Anterior tilt we needed. You don't have to put with the rounded back. The whole pressure comes to the lower back. So use the pelvic tilt here. So what we can see, tilt the pelvis forward towards the leg. Rather to go with this, tilt the pelvis forward towards the legs. Broadening the thighs help this pelvic tilt. If I'm going with the close, this one, if I'm doing this, restricted movement, creating extra stress on my lower back. If I'm widening the thighs, there is some space in your sacroiliac joint, and easily you can bend more, my dear friends. So broadening the thighs help this pelvic tilt. So extending the thoracic spine away from this pelvis. If I'm doing and going like this, I'm not extending the thoracic spine. I'm flexing the thoracic spine like this way towards the pelvis. If I'm extending the thoracic spine, extend towards away from the pelvis. Prevention of aggressively pulling with the arms to go deeper into the forward bending pose. So when we're doing for the Paschimottanasana, don't try to push too much. So prevention of aggressively pulling with the arms to go deeper into the forward bending poses. Just hold it, extend the spine, hold, extend the spine, and then go forward. In the Supta Pada Angusta Asana, reclining big toe pose, it is an excellent preparation for more demanding forward bends. You can practice some hamstring stretches, you can practice some lower back stretches, child pose you can use before to get into the forward bending. Right? You can practice some wall stretches like this way to hold it and stretching your back away from the legs. So these are all stretches which we can do before to get into the forward bending asanas. So Supta Padangusta Asana, reclining big toe pose, is an excellent preparation for more demanding forward bend, that is a deep forward bends. If we go to the next one now, preventing lower back injuries in twist, my dear friends. This is the very important topic now, because mostly in the twisting, lower back injuries happens. We must have to learn from where to move in these poses. The position of the spine in these poses, the use of the props in these poses according to the mobility of the student in the thoracic area. Because twisting we rarely used in our daily life. So what we can say, excessive flexion of the lumbar spine is also a risk in seated twist. And flexion combined with rotation puts particular force on the spinal disc. So excessive flexion of the lumbar spine, mostly if we are twisting, if I'm twisting from here, from the lumbar, creates excessive pressure. The twist has to become from the thoracic area. A little bit twist comes from the lumbar, but maximum twist comes from the thoracic spine. So you can use the modification with the chair, use the modification with the bolster also, or simply first and foremost learn how to twist properly into the sitting position. Just spine has to be neutral and I don't have to be moved too much from the lumbar, holding this hand here and just opening the chest. Holding here and just open. So open from your shoulders, move from the thoracic area, don't do this. If I'm doing this, this creates excessive pressure. And as the slide says, flexion plus rotation. This flexion, if you practice or you can check now, if you are doing flexion of the spine and rotate, you feel a different sensation, a different pain there. So before to get into this rotation, spine has to be neutral first. And then rotate from your thoracic rather to create extra pressure from your lumbar spine. So a preparatory floor pose can give support to the spine and prevent excessive flexion. A preparatory floor pose like you can use, like which we have discussed right now, that you can use. You can sit on the bolster and do some rotation, right? Or we can sit on the chair and we do this practice. This week we can do it. So preparatory floor pose can give support to the spine and prevent excessive flexion. Pressing arms, shoulders into the floor. Pressing arms and shoulders into the floor, that can increase your thoracic mobility also, and then it will not cause any excessive flexion on your lumbar spine too. Props such as block or pillows can be used for your rotation of the spine. In seated twist, the teacher should instruct student not to use their arms to force themselves into a more aggressive twist. So don't use the arms or don't create excessive over there when you're doing this way. Sometimes we are doing holding like this. So don't press too much with your arms. Don't create extra stress. Just hold it here and feel the opening of your shoulders. Right? So don't give some aggressive force or aggressive pull to your knees and to the different area. So the teacher should instruct not to use their arms to force themselves into a more aggressive twist, my dear friends. So mobility has to become from thoracic. Sometimes shoulders are tight. Not to try to go more deeper into the pose. So don't force too much to your lumbar area to open the shoulders. It will not come. So stay, whatever the shoulder mobility you have, hold the stretch. Next time it will come more. So we go for the next one now. So preventing lower back injuries in back bends. So in back bend, injury to the lumbar spine area often occurs because the thoracic spine does not bend, forcing the lumbar spine into overextension. This happens with the beginners. Whenever you ask the beginners, backward bend, they are not opening the thoracic. They are throwing the pelvis away, and there is a hyperextension on the lumbar spine. So helpful tip, maintain steady strength in your legs and root your tailbone down. So this way we can ask our student guys, steady strength on your legs. So ask the person to lift your toes up, feel the contraction on your quadriceps. Pelvic has to be neutral. So open your shoulders completely backwards, squeeze towards the spine, your shoulder blades. Take what we say, the root your tailbone down, so not excessive pressure. You can ask the person to take your pelvis backwards slightly, so tailbone goes down, open the chest, and ask the person to open your chest completely and don't throw the pelvis, just use the posterior pelvic tilt and do it. You can use some preparatory stretches. You can restrict the pelvic movement, just work from the thoracic mobility, go back. Work from the thoracic mobility and go back. You can hold something here. So opening of the thoracic, not creating any overextension on the lumbar spine. Lift up through the whole upper body and bend in the upper back as much as you can curl. Curl your head, shoulder and chest back. That's what we have discussed. Teacher also need a keen eyes for asymmetries in students' body that could stress isolated part of the spine. So a good eyes of this on the asymmetries of your student. As the teacher, give the command, inhale, go for the backward bend from here. So if you are throwing the pelvis away, stop. Just use it as a pelvic tilt, posterior, open the chest, lift your head up, curl your head down, and open the chest more and don't overextend your lumbar area. Back bend supported with props to increase symmetrical length of the thoracic spine. So again, we can use the bolsters, we can use the blocks between the thoracic spine to maintain the maximum extension from the thoracic, not any overextension from the lumbar spine. So use of the props are very helpful here. Now if we go to the next slide. So preventing injuries in the shoulders and wrist. How to prevent injuries in the shoulders and wrist? The watchful eye of a teacher alert to over effort and poor alignment can make the difference between learning and injuries. This is a good sentence, that watchful eye of a teacher. Where my student is putting too much stress can make the difference between learning and injury. Simple example if I give you, sometime when you're going for the downward facing dog, you're asking the client to do this, they are only forcing the hand like this way. They are putting all the pressure on the wrist, they are not activating the finger muscles. So that way you can see if the fingers are relaxed, right? The fingers are relaxed here. If the fingers are relaxed, only we are putting the stress on the wrist bones. It creates too much stress then. So finger has to be engaged nicely. So partially you have to create the pressure. Not only the wrist, you have to create the pressure on the wrist. You have to engage the mid part of the hand. You have to engage the finger muscles too. So then there is the balance. You can deliver the weight of the body to the wrist, to the mid part of the hand, and to the fingers. So muscle of the finger has to be engaged. It has not to be relaxed. So this is watchful eye to your students. The teacher must accommodate and not ignore those who cannot yet safely practice these poses. So you can accommodate and not ignore those who cannot yet safely practice these poses. Give some modification to them. If they are not able to do on the wrist, ask them to do it on your elbows. You can give some props. You can roll the mat and put the wrist over the mat. So you can roll the wrist like, you roll the mat like this way, and you can hold. You can press the wrist area and engaging the finger muscles. So this roll mat gives some form and padding to the students and reduce friction, right? And it will reduce the friction from that area. Spread the fingers of the hand or hands and press down even through all parts of the hand. Avoid passive weight bearing on the wrist. So spread the fingers nicely. It has to be engaged, not over engaged or not over loosened. And press down even through all parts of the hand. So engage all part of the hand, not only wrist part or not only finger. The mid part has to be, create some vacuum. Stabilize the arm or arms by contracting all arm muscles, pulling energetically up away from the floor. So when you're engaging these muscles properly, you're engaging, if you're pressing this, if you're doing this movement, relax your fingers, you cannot feel anything here, only little engagement. If I'm doing this, curling my fingers, you can pulling arms energetically up and away from the floor. So this is how we can prevent injuries in the shoulders and the wrist in general. So if we go to the next one, prevention of knee injuries. As we say, knee is dependent on the alignment of mobility of both the hips and ankles for its safety. Because knee is the junction between hip and ankle. If the mobility of the hip, mobility of the ankle affected, it affects the knee. If the mobility of the knee is affected, it affects the mobility of the hip and ankle too. So distance in wide leg standing poses, right? So don't create too much compression. When there is this one we are doing, so take some distance, take a ideal distance where your pelvis is neutral, right? Your knee is not rotating in or out, right? A ideal distance, if this is much, okay. We have to start from here in the beginning. Support of chair or wall, right? We can use the support of chair or a wall. You can use the support of chair, use the support of the wall. If the knees is going in or out, take the block between your shin bone. That we can use, that we have discussed in the alignment classes. Align the center of the knee with the center of the foot. Knee is to the side, in front or in back of the heel. If it is going into the side, align the center of the knee to the center of the foot. If it is going this, wrong. Going here, wrong. Too much, wrong. Too much away, wrong. So align the center of the knee to the center of the foot. So reflect on the actual, not ideal, for opening of hips. So reflect on the actual, not ideal. What is according to your level, your flexibility. So what is actual opening there needed, that is we have to do, not for the ideal. Prevention of hyperextending the knee in Trikona Asana. As we have discussed, if we are doing for the triangle pose here, you're going and doing this hyperextension, just avoid it. Engage the thigh muscles and slightly micro bend the knees. Center of the knee has to be with the center of the foot. So don't lock your knee. Props and proper preparation. Props and proper preparation. Practice standing poses that strengthen your quadriceps to keep your knees straight, to strengthen your surrounding knee muscles, and reclining hip openers also, because if the hips is not opening properly, it gives the more stress to your knee area. So these are the key points which we have to remember here. So how to prevent knee injuries. So if we go to the next slide. So in a nutshell, if we discuss, teachers must be trained how to plan a safe asana practice for the population of students at hand, using alternate forms of poses as needed. So individual alignments you can give, individual commands you can give. So if you have one command for every student, we are teaching a traditional way, the traditional teachings. If we have a different command for the people get more excited about the learning, and the people has this psychology that teacher is focusing on me also. Studios and teachers can require a self-assessment of each new student's level of experience, strength and flexibility in order to guide them towards an appropriate level of class, my dear friends. So students and other teachers can require a self-assessment of each new student before to start the class. Student can be advised before taking class that pre-existing condition will affect their practice, and they can be encouraged to seek help in adapting the practice according to their needs. So this has to be clear before taking the class. The pre-existing condition will affect the practice if we are not disclosing it. The teacher and student must both know what constitutes appropriate level of effort. This requires training for the teacher and the education for the student by the teacher. So in the beginning, you can just give some counseling to your students, like you don't have to go too much. This type of things, if we are doing, it can damage this, it can damage that, or listen to your body, stay into the pose properly, enjoy the breathing with the pose. If the breath is going to be disturbed, go out of the pose, my dear friends, right? So this is teacher and student bonding, how you are taking a class, how you are maintaining an environment in the class. The teacher must know how to spot overzealousness and alignment risk before injuries occur. This is a good quality of a teacher, like you should have to know, like if the people are this kind of things, you can take some distance in between two students. If one is practicing close to other and you can feel this is happening with some signs, so just give some gap or give some distance. You can add other people over there, which is according to their level of practice or her or his level of practice, and get the student to the other part. So these kind of modification we need it, right? According to the psychology of the students. If classes are large, assistant teacher can help to watch for overzealous and properly aligned students. If classes are large, assistant teachers can help to watch for overzealous and poorly aligned students. So if they are missing the alignments over there, too much people are doing yoga overall, so we need more students too, my dear friends. So these are some points that we have to focus, that in a nutshell, which we have discussed, that these are the key points. If you are, before start teaching, these all things in our mind, it helps too much to our students, it helps too much to your teachings. So that's why we say the important topic, the asana safety and prevention of injury. In general, we have discussed about the site of injury, frequently associated posture, what are the factors that are likely to cause injuries. If we go to the next one now. So this is what we have discussed in a nutshell, these all points. So be careful and read these points every day. All the asana associated injuries to the particular site. We have to be much careful, guys. So important topic. In the beginning, Please read it. This asana safety and prevention of injuries will help you to get your practices in the different levels, to help you to take your teachings into the different levels, and you can feel the difference easily. So this is how we have to grow together, and how to prevent injuries and bring your posture safely into the asanas. So I hope this must be clear to you, my dear friends. So till then, enjoy your day. Namaste. Have a nice day.